Hi there, my name is JB, and in this video I'm going to discuss about standard precautions or universal precautions and transmission-based precautions, which are contact, droplet, and airborne precautions. This topic will come out on your NCLEX around 95% all of the time under safety and infection control category. So it is very important that you know this topic by heart, and I hope this video will be helpful to you. And right at the very end of the discussion, I have one NCLEX-RN question under this topic that we need to answer, and I hope you will get the right answer. And with that all coming out of the way, let's get started. Standard universal precautions. Standard precautions are the minimum infection prevention practices that apply to all patient care, regardless of suspected or confirmed infection status of the patient in any setting where healthcare is delivered. Standard precautions include hand hygiene, use of personal protective equipment or your PPE, which includes gown, gloves, masks, and eyewear, respiratory hygiene or cough etiquette, sharps, safety, engineering, and work practice controls. So avoid recapping needles after use. Throw it directly into the sharps disposable container. Also, we have safe injection practices, which includes aseptic technique for parenteral medications, sterile instruments and devices, clean and disinfected environmental surfaces. Transmission-based precautions are the second tier of basic infection control and are to be used in addition to standard precautions for patients who may be infected or colonized with certain infectious agents for which additional precautions are needed to prevent infection transmission. There are three different types of transmission precautions. We have contact precautions, droplet precautions, and airborne precautions. First, let's discuss contact precautions. Contact precautions used for infectious diseases or germs that are spread by touching the patient or items in the room. Examples of contact precautions infections are MRSA, VRE, diarrheal illness, open wound infections with excessive drainage or staphylococci, RSV or a respiratory virus, Clostridium difficile infection, scabies, eye infections or your conjunctivitis, skin infections, impetigo, lice, herpes simplex, chickenpox or your varicella, shingles, hepatitis A, diapered or incontinent patient. So what are the special considerations for contact precautions? They are chickenpox and disseminated herpes zoster are also airborne precautions. The personal protective equipment or the PPE used are gloves and gown. Always wear when providing care. Single room or cohort with same illness. Must follow standard precautions as well. With C. diff, norovirus, and rotavirus, must wash hands with soap and water after providing care. Alcohol-based sanitizer will not work. Must use separate or disposable cutlery. Limit movement of patient from the room to essential purposes only. Use dedicated patient care equipment like blood pressure cuffs, stethoscopes, thermometers, and etc. And they must remain in the client's room. If common use of equipment for multiple patients is unavoidable, clean and disinfect such equipment before use on another patient. Now, let's proceed with droplet precautions. Droplet precautions used for diseases or germs that are spread in tiny droplets caused by coughing and sneezing. Examples are pneumonia, diphtheria, which is the pharyngeal type, rhinovirus, streptococcal pharyngitis, epiglottitis, mumps, parvovirus B19 or your fifth disease, scarlet fever, German measles or your rubella, influenza, flu, pneumonic plague, whooping cough or pertussis, and bacterial meningitis. So, what are the special considerations for droplet precautions? They are transmitted through coughing, sneezing, and talking. There is no special air ventilation. Respiratory droplets are larger than airborne and travel less distance and fall usually at 3 feet. Invades the eyes, nose, and mouth. Doors can be left open. Don mask upon entry into the patient room or patient space. While providing care, wear surgical mask at all times and follow standard precautions as well. If providing mouth care to the patient, PPE should be gloves, mask, goggles or face shield and gown, since patient will be coughing and gagging all the time. Single room or cohort with same disease. Keep visitors 3 feet away from the patient. If patient is transported to another area in the hospital, he or she must wear surgical mask and inform the receiving department in advance that the patient is in droplet precaution, must use separate or disposable cutlery. Let's proceed to the third and final precaution, that is airborne precautions, used for diseases or very small germs that are spread through the air from one person to another. Examples are your tuberculosis, your measles or rubiola, chickenpox or varicella, and disseminated herpes zoster shingles. What are the special considerations for airborne precautions? They are transmitted through coughing, sneezing, and talking. Respiratory airborne droplet nuclei is very small. It's 5 micrometers or smaller. They can suspend in the air for a very long time and can penetrate regular surgical masks. That's why, with airborne precautions, the staff must wear N95, an FFP3 or a respirator mask, and must be well fitted. After providing care, remove your respirator or your N95 mask after leaving the room. Doors and windows must be closed at all times. Negative pressure room or airborne infection isolation room, which is 6 to 12 air exchanges per hour. Single room preferred or cohort with same illness. Limit transport of patient as much as possible. If patient really needs to be transported or leave the room, he or she must wear surgical mask. Chickenpox and disseminated herpes zoster are also contact precautions. Follow standard precautions as well and must use separate or disposable cutlery. Now, I have an NCLEX-RN question under this topic, safety and infection control. I hope you get the correct answer. Here is the question. The nurse is caring for a 19-year-old male client with Clostridium difficile or C. diff. Which of the following infection control measures by the nurse are appropriate? Select all that apply. Number 1, requests that the client be assigned to a single client room. Number 2, applies sterile gloves and gown before performing client care. Number 3, ensures surgical masks and gloves are worn by staff in the client's room. Number 4, wears a single-use disposable gown and gloves during client care. And number 5, use alcohol-based sanitizers for hand hygiene and must close door at all times. I'll give you a minute to think of your answer. Please pause the video if you want to read and answer the question. Okay guys, I hope you got the correct answer. So select all that apply. The correct answers are number 1 and number 4. Number 1 requests that the client be assigned to a single client room. And number 4 wears a single-use disposable gown and gloves during client care. Remember, Clostridium difficile is under contact precaution, and the client needs to be in a single room or cohort with same illness, and the client should always wear gown and gloves during client care. Let's see the other choices, why they are wrong. Number 2, apply sterile gloves and gown before performing client care. So the word that made this choice wrong is the word sterile. You don't have to wear sterile gloves. You can wear clean gloves and gown. And then number 3, ensures surgical masks and gloves are worn by staff in the client's room. No, this is contact precaution. You don't need to wear surgical masks. So that's why choice number 3 is wrong. And number 5, use alcohol-based sanitizers for hand hygiene and must close door at all times. No. The hand hygiene that you need to use for C. diff, norovirus, and rotavirus is soap and water. Wash your hands with soap and water. Alcohol-based sanitizers won't work. And since this is a contact precaution, you can just open the door. You don't have to close the door at all times. This is for airborne precaution. Thank you for listening to me. I hope I was very helpful to you. If you haven't done so, please click that subscribe button. Please like and comment and share this video to your friends, classmates, to other nursing students or nursing graduates that you may know of. See you in the next video. Take care and happy nursing.